Hey friends, so I just wanted to pop on here and make a video about this hospital stay so far and what's been going on. So I got here at 6:30 in the morning and checked in, and they put us in the pre-op waiting area. Excuse me, I'm gonna drink some water while I talk to you guys. And then I needed an IV. It's non-negotiable. You have to have an IV. And the nurse tried so hard, this lovely nurse named Sharon, who is an absolute angel, tried so hard to get it on my wrist there. I don't know if you can even see that. And she got like 3 drops of blood. And so they had to call specialists. They're IV girls. They bring an ultrasound and they do the IV by ultrasound. And so I got the bigger vein, but it was so deep that even with the ultrasound, she had to dig around for like 10 minutes after the nurse had dug around for about 10 minutes on the wrist side. So needless to say, that was probably one of the toughest IVs I've ever gotten. Part of it has to do with EDS, but a bigger part of it is that I was dehydrated because you're not allowed to eat or drink after midnight, and it was about 9 a.m. at this point. So I got my IV finally, and then just kind of waited around, used the bathroom a couple of times, and then the anesthesiologist came in, and he was absolutely lovely. His name is Dr. Lamb, but he couldn't get my spinal. He could not get into the right spot on my spinal, and he was about to give up on it entirely, but he did end up getting it. So after, again, about 20 minutes, I have a bunch of needle marks on my back because he tried between several different vertebrae. And then I got a nerve block on the front and a nerve block on the side. And I can't remember what those nerves are called, but and I'm on meds right now, so sorry, I can't think very straight. So between the IV and the epidural, spinal, whatever you call it, I got poked by a lot of needles today, and it was unpleasant. And then when it was finally time to go, actually, before the IV or anything else, they give you these wipies that are like antibacterial, and so you have to give yourself like a sponge bath before you go in for surgery. So I did that, and then because of COVID, they give you these Q-tips with like iodine gel on them. You have to rub it on the inside of your nose, and it smelled like burnt soy sauce. It was disgusting. So I did that, and then got ready to go. The anesthetist came in. He did my blocks. It took forever, but he did get them. And then went to at that point, Brian had to leave because after the blocks, it's like go time. So they tell you to leave at the beginning of the block. And so Brian left, said goodbye to him, went into the OR room, and they had given me some kind of anxiety med that was amazing. I was not even a little bit anxious. I had been anxious all morning. Was not a little bit anxious on that table because I was high. I mean, it was a lovely medication. I was worried that they were going to give me like Ativan, because Ativan doesn't really work for me. But they gave me something else, and it was really quite helpful. So I'm laying on the table. They transfer me to the table, I should say, from the bed. And then I was talking to the nurse that's doing the count back from 10 thing, and that was the last thing I remembered. But when I woke up in post-op recovery, you guys, this part is going to be especially triggering for those of you who have medical gaslighting trauma. I had just gotten out of, my surgery took almost 8 hours. So almost 8 hours. I guess it was a lot worse in there than what I thought, because he said 6 hours this morning, turned out to be almost 8 hours. So we got my surgery done. I wake up and I'm in post-op recovery, in the most horrific pain I've ever felt in my life. Never been in this kind of pain before in my life. And as most of you know, I have EDS and I have fibromyalgia, and I have carried and vaginally delivered 2 children. Okay, this was the worst pain I've ever felt in my life. Absolutely. Without a doubt, the worst. So, excuse me. I'm not allowed to sit up, so I have to lay down. And I keep spilling water on myself. But anyway, recovery was a nightmare. Absolute nightmare. I woke up in this horrific pain that I had never been in my life. And I had a really nice nurse at the beginning. She was this really nice redheaded lady whose name I didn't catch. And she gave me she threw everything she could at my pain. She threw Toradol, Dilaudid, oxycodone. Like, she gave me everything that she possibly could, and it just was not touching this pain. It was terrifying. And then I was crying, and I don't ever cry about pain. I cry about emotional pain, but physical pain, you'll never know. Like, right now, I'm at an 8. You would never know that. But this was like a 12. It was absolutely horrific, this pain. So she's throwing all these meds at it and hoping that they'll help. Oh, sorry. And they didn't. And then I was crying, so this other not so nice nurse came over and told my nurse, take a break, I'm taking over. And so she took over, and she stood by my bed and fiddled with the meds that I was supposed to be getting. It was a tube of Dilaudid. And instead of giving me the full dose, which is the full vial, she gave me a quarter of the dose. And then when I told her it's not touching the pain, and I was crying the whole time. I had not stopped crying from the moment I woke up until about an hour later. And I told her it's not helping. It's not helping. I need help. Please help me. I was begging, you guys. I was begging. I'm going to cry. I was saying, please, God, help me. Just help me. It was the worst pain I've ever been in my life. And I was only supposed to be in recovery for an hour, but she kept me up there for 3 hours, unmedicated, immediately following surgery. I came out of the operating room, and then I had no meds for 3 hours. 3 hours. After an 8-hour hour surgery on my hip. And when at one point I passed out from the pain. I lost consciousness, and she said I said that the pain it's worse, it's getting worse, it's creeping back up. And she said, well, if you were in pain, you wouldn't get that sleepy feeling that put you to sleep just now. So she continued to refuse me meds. I woke up, and then she couldn't get me out of there fast enough. After 3 hours, she got the other nurse, and they brought me to my room where I am now. And on the way, there's bumps on like the elevator door. There's like a bump you have to go over, and it rattled my bones, and like it hurt so bad in my hip that I let out a noise, like a whimper. And she literally rolled her eyes at me. The entire time that I interacted with this nurse, she did not once talk to me except to insult me or say that I didn't know what I was talking about. And every interaction that we had was her talking to a nurse over me, like I didn't exist, like I wasn't even there. And meanwhile, I am crying in pain. It was horrific. She tortured me for 3 hours. Do you imagine coming out of an 8-hour operation with no medication? And I had just gotten out of anesthesia too, so, anesthesia will put you back to sleep because it's strong stuff. So it had nothing to do with my pain being controlled. It was all the meds in my system from the actual surgery. So, needless to say, I will be filing a formal complaint against her because nobody should have to go through that ever. Nobody should ever have to go through what I went through today. That was horrible. It was inhumane, it was cruel, it was torturous. She's a monster. I really believe that she's a sadist because the way that she was so uncaring. I don't understand why she would want to be a nurse. Like, I just don't get it. How are you going to deny somebody the meds that have been prescribed to them by their doctor, their surgeon, immediately out of the OR? It doesn't make any goddamn sense. Anyway, so I get down here to, I think it's the ortho recovery floor or something. I don't know, but inpatient rooms. I get into my room, and that lady's still with me, and so I don't say anything until she leaves, and then I lost it. On my new nurse, I told him everything that happened, and he's absolutely wonderful. His name is David, and he immediately, as soon as I got here, because I was crying, he could see how much pain I was in. I was whimpering and I was crying. He immediately almost ran to go get me more IV Dilaudid to help with the pain, and it did, because he gave me the full dose that I was supposed to get, and not a quarter dinky little dose. So, yeah, my pain isn't exactly managed, but it's not traumatic at the moment. Like, I don't know. It was awful. As for how I'm doing right now, I have my little leg pumper things to keep me from getting clots. I'm not allowed to sit up, and I have a TV and this cute little cup here you guys saw. But my plan is to just try and get some rest, because it's been a really long day. But I am okay. Everybody except that aftercare nurse was wonderful, but that situation was truly horrendous and should not have been experienced by me or anybody else. It was absolutely horrendous. And I don't know what needs to happen in order to get that woman removed from her job, but I will go to the ends of the earth to do it, because I cannot. I'm supposed to have another surgery here, you guys, in like 6 months. I'm supposed to have the same surgery, but on the left side, done in about 6 months. So I definitely need to not have that woman here. So I will be filing a complaint or whatever. Oh, and apparently while I was passed out unconscious in the recovery room from the effects of anesthesia mixed with horrific pain, Brian tried to call. He called the hospital. They sent him up to a recovery or whatever, and he spoke to somebody. Now, it was the same nurse, and she told him that I was so drugged up out of my mind that I wasn't coherent enough to have a phone conversation. So she denied me contact with my next of kin immediately after surgery. I mean, it was awful. It was really bad. So, yeah. I don't even know what else to say about it. It was just really awful. But things have gotten better since David became my nurse. He's been getting me every 3 hours. I get IV Dilaudid in the full dose. And I don't know what the full dose is, but it's close enough that I feel like I can sort of function. Like, as you can see, I'm very puffy and tired. Very puffy, very tired. Still beautiful, but puffy and tired. I just wanted to record this and kind of like keep track of things as they go along. And it's just really bittered my experience a bit. But my doctor hopefully will be in tomorrow morning, and I can tell him what happened, because he'll know what channels to go through and whatnot. And yeah, and then one of the nurses that I have on this floor, she was like, well, you don't know what she's going through. And I'm like, well, if she's having a bad day, like, so am I. I'm not being a bitch about it. So it's not really an excuse or a reason. And she didn't treat any of her other patients like that. It's because I was crying. It might have been because, additionally, they took off my head cover, you guys. I specifically asked to have my head cover on throughout the entire surgery. My doctor said it was fine. The OR team said it was fine. They all gave me bonnets, 3 of those blue bonnets for 3 of these guys, surgical bonnets to layer, because they were see-through, so they put 3 of those on me. And my hair was supposed to stay covered for the duration of my hospital stay, and it's on the first page of my chart notes, and somebody took it off. Somebody removed my religious head covering without my permission, without my consent, while I was in one of the most vulnerable states of my life. I feel so violated. And from what I understand, it was the same nurse. So I'm trying not to let that affect everything. I want to stay positive because it's better for my healing journey, but I definitely will be filing a complaint, or perhaps even consulting with an attorney, because what happened to me today was not okay. And as far as Dr. White is concerned, he's lovely. He's a lovely man. Love everything about him. I'm sure he did a great job, and he agreed to record my entire surgery for me, so I will have a video of it. I probably won't share it for a while, but I will have a video of the entire 7-hour operation. So very cool, right? But that's all. I'm okay. I survived. I didn't have any kind of complications. Everything is looking good right now. The only thing is that because I'm on so much Norco, I have to be on oxygen, because any kind of opiate kind of depresses your respiratory rate and can make you breathe less frequently. I think the blood pressure cuff is trying to take my blood pressure, and it's not even on me. But I just wanted to let you all know I'm okay, and I love you, and I will talk to you all soon. Okay, bye.